Many people believe that regular health checkups automatically mean better health, especially later in life. It sounds logical. You follow instructions, you do what is recommended, and you assume you are protecting yourself. But after the age of 70, this approach deserves a second look. Over the years, I've seen many older adults go into tests feeling confident, only to come out confused, worried, or pushed toward decisions they never expected. What's important to understand is that not every test brings clarity. Some tests can create stress, unnecessary follow-ups, or treatments that don't truly improve daily life. Research suggests that a significant portion of routine testing in older adults leads to interventions that offer little benefit while increasing the chance of complications. And most seniors are never clearly told this. They're simply told it's routine or it's just to be safe. Today, I want to walk you through 5 common checkups that often sound helpful but may not always be the best choice after 70. The goal here is not to reject medical care, but to help you ask better questions and make calmer, more informed decisions. Before we begin, take a moment to think about your own experiences. Have you ever gone through a test that left you more worried than reassured? That awareness alone is a powerful first step. At first glance, this test seems completely harmless. It's quick, painless, and often described as a simple way to understand bone strength. Many people are told it's essential, especially women after a certain age. What's often left out of the conversation is context. After 70, some level of bone thinning is a natural part of aging. Much like changes in skin or hair, it doesn't automatically mean danger. Yet test results frequently label these changes in a way that sounds alarming, even when the actual risk is low. This can lead to medications being recommended very quickly. While these medications are intended to support bone strength, they can also bring side effects that affect digestion, comfort, and overall quality of life. Studies following older adults have shown that treating mild bone loss at this age often leads to very small changes in fracture risk, while side effects are far more common. I once worked with a woman in her mid-70s who stayed active, walked daily, and had never experienced a serious fall. After a scan showed mild bone changes, she was started on medication. Within months, she noticed discomfort that interfered with her daily routines and hobbies she loved. Once her care plan shifted away from medication and toward movement, nutrition, and balance work, her confidence and strength improved noticeably. What matters most here is understanding alternatives. For many people over 70 who are stable and active, lifestyle steps may offer more benefit than a number on a report. Strength training suited to your ability, balance exercises, adequate vitamin intake, and nourishing foods have all been associated with better outcomes and fewer risks. A scan can provide information, but information should never automatically lead to fear or rushed decisions. It's reasonable to pause and ask whether the result will truly change how you feel or function day to day. Now let's move on, because the next checkup is one many people request out of concern, especially when memory feels a little less sharp than it used to. Checkup number 4, brain MRI for memory concerns. As we get older, small changes in memory can feel unsettling. Forgetting a name, misplacing keys, needing a little more time to recall details, these moments can quietly trigger worry. Many people immediately think something serious is happening, and that fear often leads to advanced imaging like a brain MRI. An MRI is a very detailed scan. It shows the structure of the brain clearly. But clarity does not always mean answers. In adults over 70, these scans frequently reveal age-related changes that are completely common and not linked to meaningful decline. Small areas, mild shrinkage, or spots that sound alarming on paper are often simply part of normal aging. The challenge begins when these findings are seen without proper explanation. Once something unusual is mentioned, even if it's expected for age, it can lead to more tests, more appointments, and a great deal of emotional stress. Some people begin to see themselves as unwell when, in reality, their daily functioning hasn't changed in a meaningful way. Large reviews of MRI scans in older adults with mild memory complaints have shown that the vast majority of findings do not lead to helpful treatment. Yet many individuals go through weeks or months of worry, additional testing, or lifestyle restrictions based on scan results that were never truly dangerous. I remember an older gentleman who came in concerned because he felt slower with names and occasionally lost track of conversations in noisy rooms. His scan showed changes that sounded serious to him, even though they were typical for his age. He became anxious, stopped social activities, and lost confidence. When his thinking skills were carefully assessed using simple cognitive testing, his results were well within a healthy range. With reassurance, better sleep habits, and less anxiety, his confidence gradually returned. For many people, the first and most helpful step is not imaging, but simple evaluation. Paper-based cognitive screenings can give valuable insight without creating fear. They assess memory, attention, and problem-solving in a way that reflects real-life function. If there are sudden or severe changes, imaging may be appropriate. But for gradual, mild concerns, jumping straight to an MRI often creates more questions than answers. Understanding this difference can help protect both peace of mind and quality of life. Now let's talk about a test that many people over 70 have experienced more than once, often without fully understanding what happens after the results. Checkup number 3, cardiac stress tests. This is one of the most commonly ordered tests for older adults. It's often suggested when someone mentions feeling more tired than usual, less energetic, or simply not like they used to. The idea sounds reasonable. You monitor the heart under effort and look for problems early. But after 70, this test deserves careful consideration. In people without clear signs of heart trouble, stress tests can produce results that appear concerning but don't reflect a real threat. These are known as false alarms, and they become more common with age. When a stress test suggests something might be wrong, it rarely stops there. Additional procedures are often recommended, some of which involve contrast dyes, invasive access to blood vessels, or hospital stays. For many seniors, these follow-up steps carry more risk than benefit, especially when the original symptoms were mild or vague. Large studies have shown that a significant portion of older adults sent for stress testing do not experience improvements in daily function or longevity after subsequent procedures. What they do experience more often are side effects related to testing itself, including reactions to dyes, strain on the kidneys, or prolonged recovery periods. I once met a man in his mid-70s who stayed active and walked daily. During a routine visit, he mentioned feeling more tired on hills. A stress test was ordered as a precaution. The results were unclear, leading to further testing and an intervention that didn't change how he felt afterward. His energy eventually improved, not from procedures, but from better hydration, rest, and pacing his activity. This doesn't mean heart health should be ignored. It means testing should match symptoms. When there is no chest discomfort during activity, no significant shortness of breath, and no sudden change in physical ability, simpler approaches may be more appropriate. A resting heart rhythm test or other low-impact evaluations can often provide useful information without triggering a cascade of unnecessary steps. The goal is to support the heart without creating new problems in the process. Now let's move on to a test that surprises many people when they hear it mentioned in this kind of conversation. This one surprises many people because for years it has been presented as a routine and responsible step. And earlier in life it often is. But after 70, and especially beyond the mid-70s, this procedure deserves a more individualized discussion. A colonoscopy is not just the procedure itself. The preparation can be demanding. Strong cleansing solutions may lead to dehydration, weakness, or dizziness. For older adults, even temporary fluid imbalance can affect how the body feels and functions for days afterward. Sedation is another factor. While it is generally considered safe, recovery can be slower with age, and some people notice lingering confusion or fatigue. The procedure itself also carries small but real risks, such as irritation or injury to the bowel, which become more likely later in life. Large population studies following older adults have shown that after a certain age, the overall benefit of routine colonoscopy decreases, while the chance of complications increases. In many cases, findings are slow-growing changes that may never affect daily life, yet their discovery can lead to interventions that carry more strain than value. I recall a woman in her early 70s who felt well, stayed active, and had no digestive complaints. She agreed to a screening after being encouraged to stay on schedule. The procedure led to complications that required a long recovery and significantly disrupted her routine. When her history was reviewed later, there was no strong reason the test needed to be repeated at that time. Current guidance increasingly supports stopping routine colon screening at a certain age for most people, especially when previous results were normal. For those who wish to continue some form of monitoring, non-invasive stool-based tests done at home can be an option. They avoid preparation, sedation, and recovery, while still providing useful information. The key is choice. Once the process starts, it can be difficult to step back. Asking about alternatives before scheduling can help protect comfort and independence. And now we come to the final checkup. This one is often marketed as advanced, thorough, and reassuring, but it may be the most misleading of all. These scans are often promoted as a proactive way to check everything at once. They are sometimes offered through private clinics or executive-style health packages and are presented as a smart form of prevention. The idea sounds reassuring, but the reality is far more complicated. A full-body scan exposes the body to a significant amount of radiation. For older adults, this matters because the scan often finds small, harmless changes that are simply part of aging. Tiny nodules, cysts, or calcifications may appear, and once they do, attention quickly shifts toward follow-up testing. What follows is often a chain reaction. More imaging, referrals, and procedures are suggested, not because something is clearly wrong, but because something was seen. This process can lead to stress, discomfort, and interventions that never improve how a person feels or functions. Large analyses have shown that scanning the entire body without specific symptoms does not improve outcomes for older adults. What it does increase is the chance of unnecessary follow-ups. Targeted imaging, guided by real symptoms, is far more thoughtful and far less disruptive. I remember an active man in his 80s who felt strong and engaged in daily movement. After a full-body scan identified a very small finding, he was sent through multiple appointments and procedures. Everything turned out to be harmless, but the recovery from the process itself took months. The scan didn't protect his health, it interrupted it. A more balanced approach is listening carefully to your body. If something changes in a meaningful way, focused evaluation makes sense, but scanning everything without a reason can create problems where none existed. So let's step back and look at the bigger picture. Modern medicine offers powerful tools, and many of them are genuinely helpful. But more testing does not always mean better care, especially later in life. Sometimes the most supportive decision is to pause and ask a simple question. What happens next if this test finds something? If the answer leads to stress, uncertainty, or procedures that don't improve daily life, it may be worth reconsidering. True prevention often starts outside the clinic. Staying active in a way that feels safe, eating nourishing foods, sleeping well, managing stress, and maintaining social connection all play a role in long-term well-being. These 5 checkups may sound protective, but after 70, they deserve thoughtful discussion rather than automatic acceptance. Your time, comfort, and peace of mind matter. If you've ever experienced a test that led to worry or interventions that didn't truly help, your story matters. Sharing experiences helps others feel less alone and more confident asking questions. Thank you for spending this time together. Take care of your body, stay curious, and choose your health decisions with calm and clarity.